Dr. Mignon Mary with the Remedy Room in New Orleans and Metairie, Louisiana, an innovative wellness clinic where we aim to help you help yourself without the use of prescription drugs if possible. So today I would like to talk about some of the newer studies that are coming out. You may have seen one yesterday on the internet. It's my goal to hopefully one day see the future that vitamin C, intravenously high-dose vitamin C becomes standard of care for patients who are sick as well as patients who are trying to prevent disease. Now let me start this video by saying, of course, there's no official treatment for CV-19. There's no preventive treatment. But in the meantime, I want to tell you about some of the results and some of these studies that are suggesting that there is an emerging, this is quote, emerging role of vitamin C in prevention and treatment of this virus. So there's a significant decrease in mortality, and especially in those who are severely ill. So what I want to talk about today is they're figuring out how to make this more efficacious, but in the meantime, we just need our doctors to start using it. So my goal for this video is to ask you to share this with anyone in the medical field who you know who might be open to something that is safe. There are many studies proving the safety of vitamin C intravenously. All of that stuff about higher risk of kidney stones has been debunked. There's not enough studies to prove that. And as you know, in the 40 years that my family has been practicing and using high-dose vitamin C, as my dad says, he could have paved multiple potholes and paved many streets with kidney stones if that were the truth. And that is not our experience. It is inexpensive. So instead of spending thousands and thousands on remdesivir and these other drugs that we've invested heavily in, why not something that's really safe and inexpensive that God gave us or nature gave us? It's non-toxic. There's very few, if any, significant side effects. It's a huge antioxidant, so it's cleaning up all this free radical damage, and it's obviously anti-inflammatory. Now, in one of these studies, they recommended and said that it also has anti-thrombotic properties. Possibly, this patient, instead of having scurvy, what everybody knows about the gums bleeding and oozing, vitamin C is crucial for collagen production and also for the strength and the tensile strength of the endothelial wall. So the vessels need vitamin C, and the majority of us are in a state called hypovitaminosis. So we are like subclinical scurvy. And the more sick you are, the more severely ill, the more depressed the vitamin C level. So all over the internet, you'll see studies about how vitamin D is important. We've talked about that. But back to my favorite vitamin, vitamin C. So we've had a lot of videos about cytokine storm. Vitamin C is going to make your immune system work better to fight viruses, to build your white cells' ability to fight infection, and to clean things up, turn up the inflammation where it needs to be, and turn it down where it needs to be quieted. So I will attach the studies. The one that I'm talking about today is in a journal called Nutrients. And it's talking about how the ICU stay and death rate is decreased for patients with sepsis, for acute respiratory distress syndrome. And so I can't wait to continue to tell this story about how vitamin C becomes standard of care. This is a no-brainer for me and for our experience, and I'm sure for the people who we've helped to take care of. What I don't understand is at the end of all of these studies, they say, despite this knowledge, there's more studies that need to be done. I don't know what we're waiting for. We have something that's really a great agent, and I hope that we can get high-dose intravenous. They're going to be labeling it, so when you're looking up for studies, look up HDIVC, HD, high-dose intravenous C. So exciting, big day, reducing death, that's the goal. I'm also here to help you dispel fear, so just because there's more people testing positive does not mean there's more people dying. So we have something that nature gave us. I hope that we can start to use it more often. And if you've stopped taking your C or you've backed off, now is the time to be proactive. Dr. Mary with the Remedy Room, please share this page, like this page so we can spread the message. And if you know of one person who could benefit, please spread the message. Thanks.